for us, it's the mission, right? How do we complete that mission in the operating room? Everybody's doing something different. We have all these, again, groupthink cultures that do all these types of things. And this is the way we've always done it, but there are better ways. For us, when we look at Trendelenburg positioning or even arm adduction, especially our first product, the Ion, is not like a sled. It's different. It goes on the bed rail. It actually adjusts to the patient's individual body habitus, and you can rotate midline. All of our IVs and everything are completely exposed, so we can always actually, in a supine position when they're level, you can actually open it and fold it down, start an A-line or an IV. When you move it towards the midline, it will lift the arms up anatomically, and there's a cutout for the ulnar nerve, so the ulnar nerve is floating at all time. So for us, it was about consistency of doing the same thing each and every time without all the guesswork.
Welcome to the Plan B CRNA podcast. I'm your host, Bobby Jones, and I'm so excited that you're here. The Plan B CRNA podcast is the only show made specifically for nurse anesthetists who are exploring options outside of their traditional career paths. This is the place to expand your mind and your goals as we uncover new ways to produce side income together. Join me for some honest, unscripted discussions with other CRNAs who are transforming their financial lives. This episode is brought to you by On-Call Capital. On-Call Capital is dedicated to educating CRNAs and other healthcare providers about investing outside of the traditional stock market. On-Call Capital also provides opportunities for you, yes, you, to create passive income and generational wealth while also lowering your taxable income through investments in the apartment and alternative investment spaces. If you haven't hit subscribe yet, make sure you do that right now so that you don't miss an episode. Thanks so much for joining me today. And now, on with the show. Welcome to another Provider Spotlight episode of the Plan B CRNA podcast. My guest today is a CRNA who's working hard to make patient positioning in the OR a more comfortable process for patients and providers alike. David Gomez has been a CRNA for almost 18 years, and in that time, he got tired of companies not addressing or even taking the time to understand the inherent surgical or anesthesia processes required for safe care. So he decided to step out and start a company. His main goal was to design products that serve to balance patient and staff safety through high reliability. His company, Infinitus Medical Technologies, has developed several patient positioning systems to help evolve the standard of surgical care. David, thanks for being here today.
Hey, thank you, Bobby. Thank you very much for having me, and congrats on this podcast.
Well, thank you so much. Yeah, it's been a fun process for sure. Learning something new every day. So, but and one of the things that I noticed when I was in school is there are so many different niches that different providers gravitate towards, and for me, I found it very interesting. The subjects of multimodal pain and nausea management, how you're trying to hit these different receptors. And, I've seen other people focus on, patient warming, minimizing OR noise, and it just runs the gamut. So how did this all begin for you?
Well, as you know, when we're taking care of patients, we have a lot of time to sit on the chair and watch everything that's going on throughout the entire perioperative process, And for me, from a patient positioning perspective, most people, we just think we do the same things all the time. We lift and move patients with sheets, and all these patient handling processes are impacted by surgical table sizes, types of procedures that we're doing. But each one of these processes, no matter who's doing them, impacts someone else in the room. And so I just got tired of seeing everything that everyone was doing with tape, towels, blankets, tape, creating these MacGyver type positioning devices or setups for their patients without any consistency, and decided to do it on my own and create a product and kind of push it to where we are today.
Wow. I love you mentioning the consistency part, because not only is there, a lack of consistency between, an individual provider and what they do for particular cases, but, the whole spectrum of providers, some will put a little bit, some will put a lot. And so finding out, or figuring out what it is that patients actually need, I think is an important part of that. So.
It is. I teach some of these at some of the state anesthesia meetings where we talk about groupthink and normalization of deviance behaviors that all healthcare cultures have, and traveling all over the country, it's amazing to see all these different types of things that they're doing, but they all still have the same inherent processes that we're trying to solve for them.
Yeah. So now I had Diane Miller here for show number 41, and she spoke of some of the challenges and difficulties in the invention process itself. And while, patient positioning isn't necessarily the same as delivering an actual medication, it's incredibly important for overall safety and comfort of patients. So, what has that creative process been like for you, and what are the hoops you've had to jump through?
Well, fortunately, unlike Diane's product, which is amazing in itself, our products are 510K exempt. We're class 1 products. So, the design and developmental phase of our products to get them to actual market, there's a lot of steps that we do in manufacturing and ISO certifications and making sure that we've done everything we're supposed to do from an audit perspective. But, to me, the whole design process is daunting as it may seem for someone who's never done it before. It's somewhat easier than actually marketing your product, and we could probably talk about that later. But it usually starts with an idea and a design. I design and prototype all of our products. The initial stage, and when I first started, as most entrepreneurs will do if they want to take their idea somewhere, is they'll go to a firm. I've learned the pitfalls of how to choose and deal with firms, and one thing I can tell if anyone's listening, don't ever go to a firm that's going to design your product and then manufacture it. Keep those in 2 separate buckets because you won't have any leverage. But we did that at the beginning, and we found all the pitfalls that went with that. And you're going to pay a lot because you're paying for a lot of translation that some of those designers will create mistakes for, that you're ultimately going to pay for because they have a high overhead of engineers they have to pay for. So fortunately, we now have partners within our group, engineers, some of the best engineers from some of the biggest companies out there, where we do all of our design and regulatory in-house. So for us, it's been a lot easier to go from concept to design to materials testing to all the things that we need to do from a scientific process of methodology and testing to get it all the way through the regulatory process and market it.
Very cool. Very cool. So, and I love that advice of keeping the manufacturing separate from the design. It seems like you would want that whole thing, everything together and everything in-house, but sometimes, if you have a problem with one, then at least you're not having a problem with the other. So you can take care of one problem in one firm and just hire a different firm instead of having to change everything that you're doing.
Absolutely. And you want to be able to have your design, right? And then take that design to multiple different contract manufacturers that you're going to deal with so you get the best deal. Because one will say, well, we'll design it for you and then we'll manufacture, but you don't know where you're kind of getting screwed in the process. Sorry for saying that, but I could tell you a story of CRNA if he's listening. He knows I tell this story all the time, but I got a good friend of mine who created this really, really amazing product that CRNA see it every day, and they have no idea that a CRNA created it. But he did those types of things. I went to a firm, and then they moved it into manufacturing for him. And when it came time to selling the product, because someone reached out to him, the guys who were manufacturing for it overseas had designed around his design patent or his patent that he had for the manufacturing process. And that's something they can do. So if there's any types of injection molding or any types of machines or a process they use for manufacturing, they can actually work around that design and hold it hostage by filing their own. And he had to pay a significant amount to have that released. So at the end of the day, you didn't walk away with as much money as you want. And so that's why I tell people, always keep those things separately.
Wow. That, and that's something you wouldn't necessarily think about. You're just, because when you get into these things, you're trying to solve a problem that you see, and you're not always looking to be protective of yourself or your, what you've invented. It doesn't come to mind that there are other people out there who are looking to just kind of make a quick buck and take advantage of you. And so that's a great lesson.
Yeah. So, and then you've got patent trolls, and you've got companies that, will disappropriate you and ask for forgiveness later. So, there's a lot to consider if you're, wanting to create a product and take it to market. And that's a daunting task in itself.
Yeah. Now, you mentioned that there's a lot of cost involved with this. I would imagine there's a lot of time that you've spent on this as well. So
Mhm.
when did you start your company, and how long has it taken to really get it off the ground, and what kind of costs were involved with that?
Yeah. So when I first started the company, I was still, working full time, nights, evenings, weekends, and all the crappy shifts no one wants to work because that helped fund the time off that I had. But, when I went down that road and went with that first firm, right? Everybody wants to go to a firm. I think all in during the phase to get it to market for our first product, which is the Ion, our arm abduction system, probably cost around 80 or 90 grand.
Okay.
And then, you've got the design process, and then you have to move it into manufacturability. And then when you're doing that, and that's the other thing, you want to keep them separate. Some designers don't manufacture a product for manufacturability, and you won't know that until you get out to that space. So for us, we had to go around and then figure all that stuff out afterwards, and it ended up costing a lot more. I can tell you that probably by the time you get your first product out, and this is again a 510K exempt product, if you do everything right, you're supposed to, and set up your design history file, and you have a PLM that tracks everything from an audit perspective, you're probably looking at at least 150K, depending on the product type, and to get it out there. So yeah, it is daunting, and for me, when you're first coming up with an idea, I will tell people there's really no such thing as selling an idea. You have to put your skin in the game. You've got to get out there, because your investors or the companies that you want to license your product, they don't want any risk. They don't want to create the will just from an idea. They want you to take it as far as you can and at least get it through those benchmark processes that reduce that risk for them to move it. So for us as an early company, no one really understood what we were doing. They thought that we were just making another commodity positioning line. And so we didn't get investment. And I put everything I ever had in this business, in my complete savings, my complete retirement, everything, friends and family, more friends, we're all good brothers, invested really small. We've never taken any institutional investment to this date. So, it really means, if you really want to go and do this, you got to put some skin in the game. But there are a lot of successes to be had if you go out there and do it, and you have tenacity to.
Yeah, man, that's an incredible story. That's not something you hear, from a lot of people it's one thing to put a ton of time, or it's one thing to put a ton of money,
Right.
and throw that. And granted, you're a CRNA, you make a good living, so you have that to fall back on, but still, we're talking retirement money, and we're talking,
Right.
that stuff's
convincing
scary.
your wife that this is something you're going to do.
Right.
And the way it's faith for us. So, it's not my money. It was never my money to begin with. And if I can do something with it, and we put it all in, to your point, I can always go back to doing what I did and work a lot harder, maybe until I'm 80, because I'm 52 at this point. Right. But we've had so much success in everything that we've done since 8 years ago that we're in a good spot as a business, and we've made it all back. So it's a success. And even if you don't, always try. If there's something you want to do, and you want to cross it off your bucket list to do something and take it, it's worth it. It really is, because you learn a lot about yourself, you learn a lot about your friends, you learn a lot about your family, but more so you learn a lot about business that will, give you the experience to be a much better practitioner and to kind of understand the whole business process, and even how hospitals make decisions and supply chains and anesthesia companies. So it's a really good opportunity to grow.
Yeah. And you mentioned, it took you 8 years, but here we are, and you can look back at that time and you can look at how you were in the very beginning when you were very green to this. And right. I'm sure there's just been an enormous transformation from that time. So, that's just amazing. So,
well, thank you.
Yeah, well, I'd love to hear more about the positioning systems themselves, and what it is that you're trying to solve as a problem. You mentioned the consistency with positioning. What are some of the other problems you're trying to solve with these systems, and how are they doing so?
So, one of the things that we've always, is consistency, high reliability. We're veteran-owned business. 80% of my partners were all vets. You know, for us, it's the mission, right? How do we complete that mission in the operating room? Everybody's doing something different. We have all these, again, groupthink cultures that do all these types of things, and this is the way we've always done it, but there are better ways. For us, when we look at Trendelenburg positioning or even arm adduction, especially, our first product, the Ion, is not like a sled. It's different. It goes on the bed rail. It actually adjusts to the patient's individual body habitus, and you can rotate midline. All of our IVs and everything are completely exposed, so we can always actually, in a supine position when they're level, you can actually open it and fold it down, start an A line or an IV. When you move it towards the midline, it will lift the arms up anatomically, and there's a cutout for the ulnar nerve, so the ulnar nerve is floating at all time. So for us, it was about consistency of doing the same thing each and every time without all the guesswork. And then after we had that product, then we had some successes for that product. And it's even awesome for lateral rotations of the table, like for hearts and stuff like that, where we can't strap patients down because of the large prep area. And then they rotate the table for IMAs. Our system will hold several hundred pounds of force on that table to keep your patient from hitting the floor, which we talk about a lot. Yeah, and I give lectures on stats all the time on how many patients actually hit the floor, and it's really daunting when people really hear the amount. But so when we designed that product, we went into our next phase, and when we look at Trendelenburg positioning, everybody uses bean bags and foam and gel and tape and shoulder systems, and they all have their drawbacks. And those drawbacks are, well, that's great. We have this process, but how do we move our process? So from an anesthesia perspective, if we look at certain tables like a Trump table or a Stryker table, that table has a 45-inch torso section minus the headpiece. And so at that point, we'll take the headpiece off, obviously, but the average human being only has a height from the top of their head to their sacrum of about 34 to 36 inches. No matter how tall you are, most people's torsos are about the same. So if you do the math, you're always lifting and moving your patient to lithotomy or expecting anesthesia to reach, to intubate from that distance, which is inappropriate, especially with COVID today. And how we do that is we have to lift patients with a sheet. And, we wanted to design around that. So our systems are, our Genesis and Hadron systems are a foam pad, and we don't use memory foam. It's a very unique foam system that is really great for pressure management. It's got really good traction force associated with it. But our systems allow the providers to always position the patients at the top of the table with the pad. And then we intubate the patient, have access to it. And then we can lift and move both patient and pad with our handles and facilitate the lithotomy movement over just lifting patients by sheet and hand. Because right now, if you're using a pad, a foam pad that's out there, you're physically having to lift the entire patient off that friction surface, and it bunches and it does all that kind of stuff, where our systems, you don't. And then, so our Hadron doesn't have our bi-wing arm system. So it's just a manual lift pad. But our Genesis, on the other hand, from an arm adduction standpoint, has a bi-wing. So that way we can tuck the patient's arms, uniformly and create a standard around it where we just roll the lower arm up with the lower wing and then use the top wing to secure that. So we don't even have to roll patients back and forth. But the benefit of that is we don't have draw sheets either. So we have 100% pad to skin contact surface area. Because if you're using that draw sheet to roll your patients back and forth and then tuck that back under them, you're going to wipe out 40 to 80% of the effective pad to skin contact surface area that you're actually relying on to hold your patients in place. And so we wonder why these pads rip and they tear and our patients drag. It's just because we've lost that effective surface area. So we've designed our systems to facilitate behaviors where we do the same thing each and every time, and then getting rid of all these variances that lead to issues that we may have, perioperatively with our patients sliding or moving.
Yeah. Oh, I love this kind of stuff, because you get into the nitty gritty of like the problem solving aspects. Like what are the real pain points for the providers in the OR who are trying to get these patients safely positioned, and then also having to figure out, like, because there were so many times where, as an anesthesia provider, you're fighting with the surgeon. Like, no, you can't have that position because you're putting the patient in some kind of compromise, and you're putting pressure on a nerve, or you're doing something. And then, how many times when we have them in a lateral position, okay, we'll just stick a foam roll under their shoulder and they'll be fine, and like, you got a 400-pound patient and you got the same foam roll that you're using for, a 120-pound patient. And, it just, you mentioned the uniformity and the, consistency, and there's just, that suffers because patients themselves aren't consistent either. So how can you adjust your systems to be able to fit those patients and the varying body habituses that you come across?
And that's gone a lot into our design, like with the Ion, right? It starts in a flat position, but rotates towards the midline. At its lowest position, it'll add about 8 to 9 extra inches, or actually 9 to 11 extra inches of lateral space on the surgical table, because your surgical tables are only 20 inches wide, right?
Yeah.
And so our Genesis, our bi-wing, we can actually move the lower wing down to accommodate for patients with longer arms, so they're not hanging their fingers off at the end. So we've designed our systems so the user can actually change their form and function to accommodate their larger patients. And we're actually working on a project with the VA right now for their bariatric programs, where we're making our standard 20-inch pad systems up to 26 inches and even larger. And we even have a thing on our website that we shot a couple weeks ago for a safe patient handling conference for all the nationwide VA folks, where, our systems are a manual lift and slide now, which is obviously better than lifting with a sheet. But our next generation will actually have mechanical lift capacity. So the problem is the industry's never caught up, the technology has never caught up to allow manual, mechanical lifting systems in the room. Well, now there's a really cool company out of Portland called SLD Technologies that they're the Apple of healthcare, by the way, but they've got this system called the airframe. It goes in their systems overhead, and they can move the lift anywhere in the operating room, and it's not on a boom. It is a very amazing system. But we shot some videos out last week for the VA where we created our next prototype generations that are 26 inches or even wider, that have a 1,500-pound load capacity. And we demonstrated with only 3 people that we can still provide the exact same thing that we're doing, where we position the patient at the top, we move them from the stretcher on our system, set them at the top, intubate them, leave the system connected, have the arms out, start A-lines, IVs, do whatever we need to do, and then move them into lithotomy, and then tuck their arms without rolling them back and forth. And it only took 3 of us to do all of these in 4 minutes, no matter how big your patient is. So, and you're making sure that your patient's not going to fall off the floor too. But, part of the other issue with the size, I can make systems wider, right? But our tables aren't wider. And people don't use bariatric extenders the way they should. And, one example is if you had a large patient and your arms are tucked, or you had a gynoid patient, someone who's got a large rear end, the lateral clearance between where their hand is and their stirrup, there's not much room. And a lot of people say, we'll just pad it. Well, that's okay, but you can pad something as much as you want, but it still only takes 32 millimeters or 0.6 pounds of pressure, of transmural pressure from that device all the way through the skin, padded or not, to start the ischemic process. So, but no one ever uses bariatric extenders to widen the table, to put on stirrups or even, fixed post retraction systems. They just assume that if they pad it, it'll be okay. As our larger patients, because a standard table only has about a 22 to 23 inch rail span. And if you add a bariatric extender on your table that has its own rail structure, it's physics. The further out you move and you put something weight, it's going to put too much strain on the existing rail mount. So we actually have a system on our website as well, where we can actually change on certain models of surgical tables. We can change the tops of the surgical tables and turn them to a 20-inch table with rails to a 27-inch table with its own inclusive rail structure, just like that. And it has several hundred pounds of force. So we're trying to evolve how we actually care for 40% of our patient population. And yet today, all we're doing is taping and towels and doing all the stuff that we're doing, and none of it makes any sense because there's no consistency.
Yeah. Well, and I know that part of that is, again, mentioning the fight that you have with surgeons sometimes, because if you expand the table, then they can't get close enough to do whatever it is that they want to do, or so they say.
Yeah, but it's all spatial,
But
right? Because the larger person is, then they're actually still close.
exactly. So, I mean, and I think that's where, if you can establish certain standards and everybody is being educated that's in that OR setting, the surgeons and the surgical techs and the OR nurses and the anesthesia providers, if they're all being taught these consistent systems, then that makes such an easier time of it, because then it's not even a discussion. This is a standard of care now.
Right.
And so I love that that's where you're trying to get things to evolve to. So, man,
Yeah.
that's fantastic. So,
well, thank you.
Now you've obviously gotten some feedback from this in places where you've implemented the systems.
Mm-hmm.
What has that feedback been like, and how has that affected, what you've done moving forward?
Well, obviously, getting any product into a hospital these days and navigating the supply chain has its own issues. And sometimes the financial outlook of someone making a decision in an office somewhere in the United States, whether it's a GPO or some supply chain personnel, they're looking at cost, but they don't understand its impact to clinical care. So, we've got a lot of different hats that we have to wear when we walk into a hospital, of how we engage with providers, how we engage with supply chain, and those are always going to be there. One of the things I can tell, your listeners is, fight for what you want, because there's no such thing as a GPO contract. It's a lie. It's a myth. It doesn't exist. There are people who want you to stay on that contract because they have people over them working for these companies that are incentivized financially to keep you on contract. So, but you can buy anything you want. So if you see an innovation out there as a provider, go fight for it. But when we are given our chance to go in, we've had some tremendous, success. And, we're in a lot of facilities. We've been in business for a long time. I don't usually name drop, but, we just recently, for an example, just got into a robotic epicenter in Texas. And their GPO is, wanting them to use a standard commodity pad that everybody buys. And our systems are a little more expensive because you can lift and move and you can do all the things that our systems do. So they had to fight with their supply chain on allowing us to come in, to the point where we trialed the system. We had all the success we know exists. And then their group wanted them to try 2 other systems that were on contract. And they were like, we don't want to, but they made them do it. So they determined for themselves, and we already determined that when we were there doing the trial, that they had a 20 to 25 minute improvement in surgical robotic dock time with our systems for standard GYN associated robotic cases, without cutting any corners, without doing anything. Because our average positioning times, even with high BMI patients, is about a minute to a minute and a half. And on our website, we always show large patients. None of our competitors will show you the process from start to finish. We actually show you the entire process. So what you get from us is exactly what you see. But we've had customers here in our state, a big customer of ours. When we first started with our Ion system and then our first generation of Hadron, their average positioning times, which, by the way, all of your users can track these in your electronic health record between anesthesia induction to incision or anesthesia handoff to incision, because that's where positioning and prep time is really there. So, but they were having, on average, and this is based on studies that we've done and surveys that we've done, but average positioning times are usually about 5 to 25 minutes. And your high BMI patients are going to be the higher times, right? So when we went into this institution, they were using a standard just blue pad that you put on and then rolling patients with a sheet and doing all the things that everyone does. So we knocked their process down with our Genesis and Hadron to 5 to 15 minutes. So almost half in high BMI patients. So a couple of years later, when we launched the Genesis, which is a complete disposable, so they didn't have to use the Ion arm capital anymore, we knocked that entire process down for them in 3 minutes. And a lot of people will say metrics and stuff, but we always tell people to take the Genesis challenge. We will literally walk in and we will compare a side by side with what you're currently doing to what we're doing here, because sadly, a lot of people have this this misnomer that if you spend more, you're somehow nurses and providers are denying themselves innovation, right? Because they think that their decisions to get something more expensive is going to impact the cost of care. That's not what's impacting the cost of care. And they fail to understand, if you understand billing and everything, or BPCI's bundled care, under CMS and Medicaid, which is obviously expanding into a higher payer mix than it used to. Mm-hmm. You're only going to get paid X, whether it takes you 2 minutes or 200 hours to do a procedure. So the onus is not turnover times and all the crap that we're doing. The onus is really to focus on each perioperative process as we're doing it. And so for us, we can track that through the electronic health record and show that cost savings that they can have, because say, for instance, a robotic hysterectomy, standard, uncomplicated, simple robotic hysterectomy BSO, I think Medicare rates last year, I think $6,700 is basically what you're going to get reimbursed for. Now, the hospital will charge money on top of that for all the devices and everything that were used, and put their customary, in this state, is up to 70% markup on that. So we also understand how that stuff works too. But the thing is, it's not spending $5, $15, $20 extra on something that can keep everyone safer and create a culture of reliability where everybody's doing the same thing each and every time, where I can knock your positioning times from 5 to 25 minutes down to 2. Wouldn't you make that case? Because now you're going to maximize that reimbursement on that bundled care procedure. And that's the kind of education that we try to give our nurses and our customers and our nurse anesthetists and our nurse anesthesiologist friends out there. So it's not benign when we make these decisions based on cost, because there is an impact clinically.
Yeah. Oh man. I love this stuff. This is so neat. And, we haven't even touched on the real manufacturing process. And,
mm-hmm.
Cause you mentioned, you're here in North Carolina, same as I am. And, so you've got a couple of different places around you that are doing your manufacturing. What has that process been like? Cause we talked a little bit more about design and that part of it, but manufacturing, how have costs fluctuated with any of the products that you're doing? And I knew I'd get you there. Yeah. I knew I'd get you chuckling there, because things are all over the place.
This morning. Yeah. I can tell you from a labor perspective, we have always manufactured all of our positioning products in rural North Carolina. We focus on, we're a veteran-owned business. We're made in the U.S. We care about rural manufacturing because a lot of those jobs, especially in the furniture industry, as you know, being in Winston-Salem, everything throughout that corridor in the furniture industry was outsourced to China, right? Or Vietnam or some other company. And I'm okay with Vietnam because they're a TA compliant nation. But there's been a severe financial impact to people in those areas. So what we did is we wanted to get some of those groups up, and there were some who were already 1345 process or had ISO 1345 or ISO 9001 processes. So we wanted to pair with them. But I will tell you, and I will tell you, people say buy American, but healthcare rarely buys based on that mentality, right? We're going to support American jobs. They just want the cheapest thing that they can get, and they don't care where it comes from. But we're a little different. We have way less margin, than most companies, obviously, who manufacture overseas, but each of our systems are handmade. But I can tell you, just even with our phone products since January, there's probably been about an 80% cost increase. Then we're dealing with labor issues because there are people not coming to work and people just not showing up. They'll have them for a few days. So it's been challenging for everyone and all the manufacturing industries. Even with some of our suppliers where we get some of our materials from, we're hitting more and more backlogs of as we're growing, because we've actually been growing throughout all this phase, but we're starting to hit a lot of backlogs because there's not any materials coming, because some materials, especially non-wovens, ultimately are all going to come from overseas. And so it's very hard to get stuff over here. Shipping containers, it used to only cost about $1,600 to get a shipping container and then fill that shipping container to bring it over. That costing today is anywhere between $16,000 and $23,000. So you can understand why there's a cost inflation of everything that's coming over here in terms of transport. And that's ultimately what we're seeing in the healthcare industry in terms of supplies and medications even. So, I would honestly say at this point, there was pre-COVID prices for everything in healthcare, and now there's post-COVID prices, and we have no idea where that's going to go and when that's going to stop, because all the things that I'm seeing, in the background, as a manufacturer and dealing with raw goods and materials, is that it's about to get way worse before it gets better. And so, it's hard for small companies to navigate, but at least we're small enough to be agile. I couldn't imagine having, 1,000 or 5,000 employees and have to, and not have the capacity to give products to our end users and continue to make their paychecks. So it's hard. I'm blessed in that sense, but I really feel for everyone out there in the industry that's dealing with this.
Yeah. Well, so I want to kind of end this on a good note. So what has been the best part of all of this for you? What have you gotten out of this, personally, professionally, however, what's been the best part for you?
Obviously it's very highly nuanced question, right? For me, I guess it is given me the ability to learn more about myself, learn more about, what's important, try to learn more about, because as an entrepreneur, you have to do this and you're grinding every day. And sometimes you don't think about the impact that it has on your family time and all that kind of stuff, where, now I'm not hustling as much, where I can really kind of slow down and really, spend more time with the family and do all the things that I need to do as a parent, as a friend, with all of my other friends and stuff like that. So, but, given that, I've had a tremendous amount of support from my family, tremendous amount of support from friends, tremendous clinical support from colleagues out there. So for me, at the end of the day, I'm dependent upon all of them. And that's one of the things about this ecosystem that we build as entrepreneurs is, the jobs that create, even though there's changes in our family lives and stuff like that, our family supports us. Our family does a lot of stuff. So for me, it's really been about grace, learning a lot of grace and humility, being told no a million times. Just, you got to get up off the ground and pick yourself back up and just get out there and knock on the door again. Because you're going to have all those setbacks, but you'll find that you're very resilient if you want to be, and you can't take any of it personal, especially when you're going out there and marketing. So you'll learn a lot about yourself if you do this. You'll learn a lot about your friends and, who's there for you, who isn't there for you. So for me, it's been extremely eye-opening throughout the whole process. And I couldn't have done it without all these people.
Yeah. Yeah. That's, I love that point about, relying on other people, because you can't stand on an island. You can't do this kind of stuff alone. This is a true project, and it's like the ultimate group project,
Right.
So, that's awesome, man. Well, I've really enjoyed getting to know you today, David, and getting to know more about the products that you have, the company that you have, and how you've run it. I think you've dropped a lot of value today. And so
thank you, Bobby.
I would love for our listeners to be able to get a hold of you. How can they find you and contact you to get more information about you and your products?
You can go to our website, infinitusmedical.com. That's INFINITUS medical.com. And check out our products. We have a bunch of videos and stuff like that. We can provide testimonials for people, who want to learn more about some of our customers. They're willing to give them those testimonials personally. If anybody wants to reach out to me personally to ask me some things about, I'll give some free advice up to a point, obviously. But I'll give a lot of advice to a lot of people who are starting out on this road, because, there's a lot of wisdom that can be gained that people will share, in this process. If they become successful, they don't want you to make the same mistake. So there's a lot of folks out there who are willing to do that. And even in the CRNA space, so that anyone can reach out to me anytime. My email is is in David.Gomez, Gomez @Infinitus. That's INFINITUS medical.com. Drop me a line if you have any questions, if you want to know kind of the process of even how to get started, resources that you can do. And there's a lot of good resources even in university systems. Like we used to use Western Carolina a lot, out in Catawba, or not Catawba. We've dealt with those guys out there too. But out in Cullowhee, where you can take your idea to their senior project, their senior engineers who are about to graduate, so they can get real world experience and get a prototype design for you. And they don't have any IP stake in it. So there's cheap resources to get, some stuff out, and I can kind of lead you down some of those paths.
So cool. And we didn't even talk about marketing. Do we need to hit on that real quick? What can you tell me in about 30 seconds?
Marketing. There's a lot of marketing out there. Don't always believe it. I can tell you marketing really wags a dog in the medical device industry. You want to see something, how it works. And if you see something, how it works, don't get mired by the pretty little pictures or the even the pressure management things that you see on there, because they're not factual. So just always, like anything else, just beware and ask to see how something really works for you and determine that value for yourself.
Yeah, don't get swayed by the Panera bread lunch that they bring in, right?
Correct.
So, dude, this has been cool. I've really appreciated this conversation. Thank you so much for being here today.
No,
David.
Thank you, Bobby. Thank you so much.
Building a team is part of any successful endeavor. And in the gig economy, there are more opportunities to get a business off the ground than ever before. What I appreciate about David is his approach as a small business owner. He's humble enough to recognize that it's not just a one-man show, giving credit to so many others for their roles in this journey. David also tries to remain nimble enough to pivot as the market demands, yet he's still trying to help U.S. manufacturing get back on its feet at the same time. What a cool story. He also realizes what he's up against when introducing his products to new places. Decision makers in healthcare aren't always driven by what's best for the patient, but instead by the cost of implementation versus the cost of keeping things as they are. It's an unfortunate reality that I saw way too often in my own career, utilizing inferior products while continuing to provide exceptional care for patients. Problem solvers like David help us to bridge some of those gaps with better solutions and systems that help patients without breaking the bank. That's going to do it for this one. If you're interested in streamlining your positioning process, make sure you check out David's website and learn more information. As always, thanks for listening, and I'll see you on the next episode. Thank you so much for joining me for another episode of the Plan B CRNA podcast. If you haven't already subscribed and reviewed the show, I'd be honored if you took the extra time. It really helps to expand our reach and get the word out about the show. If you're a CRNA who is interested in sharing your story on our podcast, I'd love to have you. Please email me at bobby@oncallinvestments.com for more information. This episode was brought to you by On-Call Capital. They are dedicated to helping providers like you develop passive income and generational wealth through investments in the apartment and alternative investment spaces. Feel free to check out their website at www.oncallinvestments.com and subscribe to their free educational email series. You can find On-Call Capital on Facebook, Instagram, and Twitter. You can also check out our YouTube page, where you'll find all of the show episodes along with other educational videos. Thanks for listening, and we'll see you on the next episode.